when I had my first PRT, we had a very close-knit Facebook group for patients, and one of the people there had just finished the his piece in the trial, which I hadn't heard about yet. So I asked him what it was, and then I looked things up to see if it could be anything for me. So basically it was telling each other about things that we heard about that got me there. When I heard about it, I was just about to have my final consult to see what the results were of the PRT. And because I'd heard about the trial, I immediately asked my doctor when we got in if there was any chance of enrolling. She immediately got her phone out and started phoning the people she knew were in this trial conducting it in Utrecht, and made sure that I could be seen to see if I was the right person for it. So it was basically in a consult after to get the results of the PRT that I more or less enrolled, because I'd heard about it, I asked about it, and I was enrolled. My first reaction was to look things up on the internet and basically also on the patiëntenvereniging, the netgroep, because they tend to have quite good information. And as I was collecting this information, I realized that I was probably a very good candidate if I could enroll within 2 or 3 weeks, because otherwise the period between the first treatment and the trial would have been too long. So that's basically how I did it. As far as I could see, I was a good candidate for this trial. And as far as me was concerned, I more or less decided that if this was a possibility, it would be an outstanding chance of having treatment that wouldn't otherwise be available, A, but B, that would probably bring me a lot. So that's when I decided to make sure that I could at least have a chance to get in. They look at more things than it appears they look at when you're not in a trial. So the scope's wider. You have to be there more often than you would in general care, because they have the set timetable where they want to see people so they can compare everything with the other people in the trial. So you get the certain time points, whereas in general care, it's slightly more fluent. So you are seen after, say, 4 months, but if it's 5 months or 3.5, it doesn't make such a difference. So that I did find, and you go to the hospital more often. If I wanted to take part in a trial, which I thought would benefit me quite a bit, I would then have to make the effort to see people in the hospital slightly more often because of the trial. So if you want to take part, you also have to make some offers. And if you're not prepared or not able to do that, then you can't really take part in a trial. I had the treatment in November 2018. I did have some PRT since then in 2023, but the metastases in the liver tend to rather stay behind on a PRT, which is why they thought of this trial along the lines of if we treat the liver separately after the PRT when the liver has already had some effect, you give them an extra, literally whack to make it come in line with the rest of the body. That was the whole idea about the trial. Inform yourself, talk to other patients, talk to your doctors, read as much as you can, try to join a group of other patients online and read everything you can and consider what might be the advantage of actually taking part in a trial, as in a treatment that you wouldn't otherwise be able to get. For quite a few patients, this might be difficult because there's things you may not understand or that are slightly too advanced to get the meaning of. But if you have some friends or family or who've got a better comprehension of medical things and medical language, ask them to look with you and make yourself heard, because you will not be admitted to a trial if you don't ask. You might be the one left out because you never said you wanted to take part. So stay up to date and make yourself heard if you think it would be something that might benefit you.